All right, good afternoon, everybody. Thank you for joining us for our press briefing on what the state of Nebraska is doing to slow the spread of coronavirus here. And wanted to start off, as always, by reminding folks that as we continue to loosen restrictions, as we did earlier this week, it's really important that all Nebraskans continue to practice social distancing, especially keeping that 6-foot distance between you and other people when you're out in public places, making sure you wash your hands frequently, avoiding large groups, wearing a mask when you go to the store. These are all things that will help us slow the spread of the virus here in Nebraska. I also want to thank all of our Nebraskans who have been taking these steps and people who have been sacrificing to be able to slow the spread of coronavirus here in our state. It has absolutely worked. We have preserved our hospital capacity, which is what all these steps are intended to do, to make sure that we slow the spread of the virus, that we can provide that hospital bed, that ICU bed, or that ventilator to anybody who needs it when they need it. We've been incredibly successful in being able to provide that. As of today, our hospital capacity is at 38% of hospital beds, 44% of ICU beds are available, and 80% of our ventilators here in the state are available. And you might have noticed over the weeks that we've been talking about this that our hospital bed capacity used to be, in the high 40%, and now it's in the high 30%. But the number of coronavirus patients in our hospital has actually been going down. In fact, we've got 131 patients as of today that are in hospitals because of coronavirus, and that is down from 149 on April 25th, which was really the first day that we started getting good data from hospitals on this. So we've got the lowest number of hospitalizations due to coronavirus that we've had since the end of April. And yet the hospital beds are coming down. That means other people are going into the hospital. Maybe people who have put off that elective surgery or put off some health condition that they've had that now they're going into the hospitals. And again, this is part of, how we preserve that hospital capacity for those folks who need it, not just coronavirus patients. So we've been tremendously successful in that. And actually, if you look at where we are today, we've got the lowest hospitalizations and the lowest unemployment rate in the country. Our unemployment rate is 5.2% according to the Bureau of Labor Statistics. The next closest state is Utah at 8.5%. So we are more than 3 full points better than the next closest state. So everybody in the state that has sacrificed, it is work. We have been able to find that balance in slowing the spread of the virus to be able to make sure that everybody can get that hospital bed or that ventilator. And we've also been able to allow people to start returning back to a more normal life. That's why we've got the lowest unemployment rate. Again, but it still depends on continuing to practice social distancing, so please continue to do that. Part of what we do to combat the coronavirus is test people to make sure that when we find people who have been infected, that they isolate so they don't infect other members of the community. And then we do contact tracing to find all the people they've been in touch with, to ask them to monitor their symptoms or get them to quarantine. And so we want people to continue to look at signing up for testnebraska.com. That's going to be really important as we go forward to make sure that we're continuing to do testing to find people who may have coronavirus so that we can get them to isolate. Through the balance of the weekend, we will have National Guard testing in Hastings, Imperial, North Platte, Omaha, Seward, South Sioux City, and Springfield. And again, we've released all the restrictions on that testing. So essentially, if you sign up for testnebraska.com, you can go look to get scheduled. We don't have any more restrictions on prioritizing people. So you can go, if you sign up, you can look for starting to get scheduled in that testing. So please consider signing up for testnebraska.com and looking for a place to get tested. Next week, what we're doing is we're going to shift the program a little bit on testnebraska.com. We're going to start transitioning away from the National Guard so we can allow them to start returning back to their normal lives. And then we're going to be working with healthcare providers and hospitals to be able to start doing that testing for us. So next week, we're going to have Blair Memorial Hospital, Community Hospital in Columbus, Good Neighbor Health Center in Columbus, Kearney Regional Medical Center. We're also going to have Faith Regional Health Services in Norfolk, Franciscan Care Services in West Point, and York General Hospital doing testing for testnebraska.com. So again, if you're one of those locations, please see your hospital or healthcare provider with regard to how you can get scheduled for that. So we'll be doing that. So that'll be great. Now, Also, we talked about a few weeks ago with regard to the CARES Act money that the federal government provided to the state of Nebraska. It was a total of $1.25 billion. Douglas County got $166 million of that. The state has then approximately $1.084 billion that we will be distributing, and we outlined the ways we're going to do that. One of the ways that we said we were going to do it is through our Community Cares program. This is going to be a program that is targeted at organizations that are providing folks who maybe have food insecurity, have housing needs, have mental health needs, behavioral health needs, and so forth. And so we were going to distribute about $85 million to those organizations to be able to help them continue to provide those services to Nebraskans during this pandemic. Today, I've got Didnt Smith, who is our CEO for the Department of Health and Human Services, who is going to talk about that program in more detail today. We're going to have the application period start opening on Monday, and so she's going to go through the programs that we have available and how nonprofits and community collaboratives can sign up to be able to receive some of this funding. So with that, Didnt, I'm going to ask you to come up and say a few words about that, and we actually have a PowerPoint presentation that's going to go along with that. So, Didnt, I'm going to turn it over to you.
Thank you, Governor. Good afternoon to everyone, and I am so excited this afternoon to be talking about DHHS's Community Cares. I'm joined today by my Chief of Staff who has helped me pull this presentation together, and for those questions that I can't answer, she's here to help me with those answers. So again, we are excited about being here to talk about Community Cares. As you remember, back in May 27, 2020, Governor Ricketts announced that Nebraska Coronavirus Relief Fund was going to be enacted. And as you remember, these dollars are going to be utilized particularly for community cares for those non-for-profits, houses of worship, child care, and charitable organizations to help them continue to provide services in the communities of Nebraska. If you look on the slide, you will notice that Nebraska's plan includes approximately three areas. One that has to do with state and local government, grants for businesses, and also resources for unemployment insurance. For the Department of Health and Human Services, we will be administering approximately $85 million. As I said earlier, this announcement will include direct assistance to charitable organizations as well as provider organizations who have experienced during COVID-19 loss, or they have experienced an increase in expenses due to the COVID-19. We're hoping that these dollars will be used for the following things: meals, housing, shelter, behavioral health, outreach services to underserved populations, particularly communities of color. You will notice in our $95 million giving, there are going to be some examples or some giving that is going to allow for one-time only payments to child care providers and centers for worship. This will help them. We have heard in the community over the last 90 days that some of our houses of worship, some of our child care providers have had a very difficult time being able to purchase PPE as well as cleaning supplies. And so we want to make sure that we assist those organizations with that, with those supports so that they can keep our child care centers open and then worship can continue. So let's start with the very first grant. The very first grant is for $40 million, and we're calling that the stabilization grant. Who's eligible for that grant? Well, it's people who are 501c3 organizations and select provider organizations who are licensed with the state of Nebraska. This particular giving is, again, $40 million, but it's a one-time payment of at least $12 million to help those organizations look at recovery and reduced income revenue. 12, did I say 1,200? I'm sorry, 12,000. 12,000. Did I? Let me correct that. $12,000. Thank you, Governor. The application process begins on Monday, June 29th, and we're going to refer you to our website. So here's the process for the $40 million for which you can get one-time payment. I want to say it again, for $12,000. The application process begins on June 29th. The closing period for the application is on July 6, 2020. We're hoping that all award notifications will be July 15, 2020. Let's go to the second giving. The second giving is really like a traditional grant. And here, again, we're looking at 501c3 organizations and those selected providers and organizations who are licensed through the state of Nebraska. Here, we want to include our behavioral health regional authorities and other behavioral health entities who provide behavioral health services out in the community. This is a competitive grant. The typical award will be between $50,000 and $2 million. Again, I want to say traditional grant, which means here's what we're expecting. We're expecting a program plan, we're expecting a budget, and we want to see what do you anticipate the outcomes to be for the money that you have requested from the state. Applications will be evaluated by my staff, an impartial review. I have staff from all across DHHS who is going to be making the award decisions. So we want this to be a comprehensive process. We want it to be with the staff of DHHS who have multiple years of experience working in the community and looking at traditional grants. Again, we will begin to take those applications on Wednesday, July 1st. Eligible organizations must provide a complete and accurate information about their organization and detailed program plan and budget. So I want to clarify, when we say traditional, we're looking for an explicit program plan that talks about the budget you need and specifically what the accountabilities and outcomes you hope to achieve by December 30th, 2020. So again, I want to repeat, the application process opens for the Response and Recovery Grant. It opens on July 1st, 2020. The application date for closing will be July 8th, 2020, and award notifications will begin around July 15th. Some people will ask, well, we heard when the governor made the announcement you had 4 categories and you're down to 3. What we did with behavioral health and the mental health, we rolled it into the Response Recovery Grant. That's why it's down to 3. Finally, $2 million. $2 million is going to be used for what we call Healthy Place Grants. And I want to go over again who qualifies for this. Again, it's going to be our child care providers, those who have our license exempt subsidies, and those who are 501c3s and centers of worship. Again, there's going to be a one-time payment, $250 for child care homes. That's people who provide child care in their homes, but have been, who are exempt. $500 for child care centers, and $500 for our centers of worship. This funding is to be utilized for purchasing PPEs as well as to help with some of the disinfectant cleaning supplies that they may need to reopen and be back in business or to stay open. Again, I want to say that the application begins on Monday, July 6, 2020. The date that the applications will close will be July 12, 2020, and our award notifications will begin July 2020. Next slide. So we wanted to make sure that you were able to log on to a website. And here's the website that you should go to begin to find out all the information that you need about the application. One of the things I forgot to tell you is that not only do you get an application for the areas that you want to apply, but there's also a guidance document that is attached to the applications as well. So we give you explicit guidelines that you need to follow, and the application, I believe, is self-explanatory, so you should be able to follow that. Again, I want to state again that the stabilization grant, that application begins June 29th, 2020. For the response and recovery grant, which again is our traditional grants, that application process begins July 1st, 2020. And then finally, the Healthy Place grant, again a one-time only grant, that one begins, the application process begins July 6th, 2020. So for the very last slide, I believe, we're talking about outreach and communication. We want to ensure that we are answering each and every one of the questions that you have about the application process. And so what we have decided to do is we're going to be doing personal touches to everybody in the community, all the major association, provider groups, child care providers, houses of worship, because we want people to know that this money is available and ready for your use. The second thing that we've done is we've developed a call center. I have between 5 to 10 staff who are going to be available to, probably toward the afternoon on Monday, June 29th, to answer any of your questions. You see the phone number listed there. We want you to use that phone number as a way to give us a call if you should have any questions about the application process. I also want you to know that our application processes, all three, have been translated into Spanish. So we want to encourage communities of color, worship centers of color to please apply, and we stand ready to answer any questions that you may have. And then down at the bottom, you will notice our website address. Please feel free to go onto that website address and be able to click on and select the application for which you think that you qualify for, so that we're able to give you the necessary assistance. The Department of Health and Human Services is excited about this. I think in my 30-year career, I've never been able to give away this much money. And I want to make sure that I am giving it to the communities and the organizations that can benefit from our giving, that we are indeed serving the people who really, really need our care. And I can only do that through your help. Please feel free to give us a call. You see the phone number. Please give us a call so that we can answer any questions that you may have about the application process. At the end of today's presentation, Emily has a one-page handout that she wants to give the media folks that are here in the room, that again explicitly talks about the grants, the due dates, and how much each one of those givings or investments, how much they are. Thank you again for your attention. Governor, I always take your notes. I know, I always take them.
Thank you very much, Danette. Appreciate it. And again, remember the stabilization grant application process starts on Monday, so please don't delay. And next, what we'd like to do is talk about vaccinations. Now, these are not vaccinations we're talking about for coronavirus, but your regular childhood vaccinations. We've heard from healthcare providers, they're concerned that with the restrictions that have been in place and people staying at home and so forth, that parents have not been getting their children vaccinated. And so to talk about that today, we've got Dr. Antone, who is our Chief Medical Officer, and also Karen Vincent, who is our Deputy in the Public Health Department, to talk about those vaccinations. So Dr. Antone, I'm going to call you up to talk a little bit more about this.
Thank you, Governor. This is my first time up here talking about vaccinations, but I'm hoping it's not my last time, that I'll be up shortly to speak of other vaccinations. But today we want to mention about vaccinations that probably haven't been given over the last 2 or 3 months because of the pandemic. As we know, vaccines are one of the greatest public health achievements ever. They are among the most successful, cost-effective public health tools available for preventing disease and death. We're all aware of that because of what's going on now. Vaccination can protect against 14 serious childhood diseases, including measles, mumps, flu, polio, and whooping cough. According to the CDC, for children born between 1994 and 2018, vaccinations will prevent an estimated 419 million illnesses, 26.8 million hospitalizations, and 936,000 deaths over the lifetime of those children. Vaccines not only help protect those who receive them, but they also help protect the entire community by preventing and reducing the spread of disease. In 2019, Nebraska ranked 5th in the nation for childhood vaccinations and 16th in the nation for adolescent vaccinations. However, during this pandemic, data is showing a decline in routine childhood vaccinations. As a matter of fact, I had a chance to visit Children's Hospital a few weeks ago. And that didn't mean they weren't seeing patients, but it was done via telehealth. So a lot of the in-person visits were cut down. But when I saw that telehealth visit, I realized how important that was, how efficient it was, how great it was. But it's hard to give a vaccination over the telephone or a video monitor. So in Nebraska, if you compare immunization rates from January through April of last year compared to January of April of this year, the data shows that we've dropped quite a bit. For children under 2 years old, our immunization rates are down 10%. For children 2 to 7 years old, our immunization rates are down 32%. And for children aged 7 through 17, our immunization rates are down 35%. So quite a bit of a drop. So the CDC and the Academy of Pediatrics recommend every child to continue to receive their routine vaccinations, even if it's going to be late. Even during now our pandemic as we open up, and visits will be more reliable. So I'm going to turn it over to Karen Vincent. She's our Deputy Director for Public Health, overseeing health promotions, and she'll give more information on how parents can get their children caught up on their vaccinations. So Karen?
Dr. Antone. As communities are opening up, it's really important for parents to work with their healthcare provider to make sure that children are staying up to date on their routine vaccinations. So if your child is due for a well child visit or an immunization, call your healthcare provider's office, local clinic, or health center and ask about how they are offering visits during the COVID-19 pandemic. Many healthcare providers are taking extra steps and precautions to make sure visits are safe during the pandemic, including making changes to their typical workflow, including having all staff and patients wear masks, reducing the number of people in waiting rooms, scheduling well child visits at a different time of day than sick visits or at a different location, allowing only one adult to accompany a child during appointments, and offering telehealth appointments with separate in-office appointments for immunizations. DHHS offers the Vaccines for Children program, or VFC program. It's a federally funded and state-operated vaccine supply program that provides vaccines to eligible children at no cost or low cost at various providers throughout the state. Children are eligible for the VFC program if they are 18 years old or younger and meet at least one of the following requirements, and those are American Indian or Alaska Native, Medicaid eligible, uninsured, or underinsured. The VFC program helps to ensure that children have an opportunity to receive vaccines and maintain their health. Last year, in 2019, the program helped more than 90,000 children receive vaccines across the state. The majority of VFC clinics across the state are open and are offering vaccinations. So more information on the VFC program is available on the DHHS website, which is dhhs.ne.gov/immunizations, or by calling 800-798-1696. We continue to encourage parents to stay up to date with their children's vaccines, and if they've fallen behind, to contact their healthcare provider to get caught up. Ensuring that children receive routine vaccinations helps prevent disease and protect them both now and into the future. Governor.
Thank you, Karen. Thank you, Dr. Antone. Again, important message about making sure that your childhood vaccinations are caught up, especially as we look to getting back into school this fall. There's going to be a lot of things that are going to look different, but childhood vaccination should not be one of them. So please get your child vaccinated. All right. Next, got some good news to announce as well, that you may recall last year Nebraska won the Silver Shovel Award from Area Development. Area Development is one of those relocation, site development type magazines, executive level magazine that looks at the types of investments you're getting in the state of Nebraska. And we won the Silver Shovel again this year, for the second year in a row now, for the types of investments that are high value and high job creating. So we're really pleased to be able to receive that acknowledgement and the great work that the Department of Economic Development has done to be able to work with our local chambers, our public utilities, our community leaders to be able to attract that investment. I think it's also important to note that no company invests in a generic place called Nebraska. They only invest in local communities, in a specific place. And so those local partners are incredibly important. Having a welcoming community to welcome in that investment is critical to getting that investment. So we really need to work hand in hand with our local partners, and they've done a fantastic job, as has done the Department of Economic Development. So congratulations all on winning the Silver Shovel Award again here for our investments in 2019. Upcoming schedule. So immediately following this press briefing, we will have our Spanish language press briefing after we get the screen taken down and get reset up. We'll have our Spanish language briefing, so starting roughly 3 o'clock p.m. Next week, we will be doing on Tuesday at 2 p.m., we're going to be doing a ceremony in the Rotunda with our top ACT and SAT scores in the state of Nebraska. So we will not have the traditional press briefing. We're going to do that event for our ACT and SAT students who have gotten that top score. So that'll be an exciting program, but it's not going to be this briefing. And then we'll have this briefing again at 2 p.m. Central Time on Thursday next week to be able to talk about the things that we're doing to slow the spread of coronavirus. And then, of course, that will be followed by our Spanish language briefing at 3 p.m. Central Time. So the next time we're back in this room will be 2 p.m. Central Time next week. Okay, and that gets us through our prepared program. And now we're going to get into our questions. The first of the questions that were submitted ahead of time. From Steve White, NTV, do you expect Phase 2 counties to move into Phase 3 soon? And we are working with the local public health directors with regard to the schedule on that. We've had those conversations, so I'd say stay tuned with regard to when those 4 counties will move into Phase 3. If not, would you consider changing the DHMs on a county-by-county basis? We're really not looking at doing that right now. We're managing this on a public health district to try and remain, keep some uniformity within that public health district. The follow-on question here, does it still make sense to have Merrick or Hamilton counties included with Hall County? Again, I know that Merrick and Hamilton have not been impacted the way Hall County has, but again, even if you look back over the last 2 weeks in Hall County, they've been averaging less than 2 cases per day. So again, we'll continue to have those conversations with the local public health director and the mayor in Grand Island, but we want to try and keep everybody moving forward together at the same pace. From Christian Wagner, NTV. What is your reaction to President Trump's action this week regarding work visas for people outside the U.S., especially the impact on farms and ranches here in Nebraska? So I believe that when the president made his announcement, H2A workers, which are a lot of the ones that are working on our farms and ranches, were a lot of the agricultural was exempted, so probably shouldn't have too much of a big impact. I do think it's prudent to be thinking about limiting the number of people coming from outside the country. Other countries are doing the same thing to make sure that we're slowing the spread of coronavirus here. I think it makes sense to take a look at current workers that are here in the country and allow them to be able to maybe extend and stay here. But I do think it's prudent to be able to be cautious about letting people in from outside the United States who could potentially spread coronavirus here in Nebraska. Bill Shammer, 1011. Has the state been able to determine the number and percentage of asymptomatic COVID cases? If so, what have you found? If not, when will that data be collected? There really isn't a good way to collect that data because we get data from we get testing done in a variety of different ways. We get Test Nebraska, we've got the Nebraska Public Health Lab, we've got University of Nebraska Medical Center, we've got our commercial labs that are all doing these testings, and a variety of different providers who are requesting those tests. So you've got hospitals all across the state, you've got different healthcare providers and so forth, our FQHCs, our federally qualified healthcare clinics. Everybody's doing these tests. And so we don't really have a way to determine when the person gets a test if they're symptomatic or not symptomatic. And just quite frankly, I'm not sure what we do with that data. So we try to really focus on data we make decisions with. So we don't really have a plan right now. Not saying that might not change in the future when we know more about the virus and know, for example, if you're asymptomatic and when you start infecting other people, or if you do it all, that sort of thing. If we've got some hard data on why that would make a difference to us, then we'd probably see what we could do to be able to get at least some sampling of the data. But right now, we don't have any plans to collect that data. From Tara Campbell, WWT, Channel 6 in Omaha. From the perspective of the governor's office, how does declaring an overcrowding emergency impact priorities you set in spending? Actually, earlier today, Director Frakes and Roz Cotton, who's in charge of the Parole Board, did a press conference with regard to what the bill is going to, the law, I should say, that says that if we're over 140% design capacity on July 1st, there's an overcrowding emergency declared, and that the Parole Board then has to accelerate what they're doing with regard to parole. The Parole Board has actually already been doing that. So Roz Cotton and her team have been stepping up the number of parole hearings. I think it's important to note that 85% of our inmates are not parole eligible, that of the 804 inmates that are parole eligible today, 35% of them have been out on parole already and have violated that parole in some way, which is how they got incarcerated again. Of the folks who are parole eligible, 23% still have programming complete. In fact, of those 804, 105 are either refusing to do their programming or are not accepting the programming that we've got in line there. So again, we can't necessarily force somebody to do the programming. If they're not going to do the programming, they're not going to be eligible for parole. And about 42% of the 804 have a parole hearing date scheduled between now and January of 2022. So the Parole Board is taking steps to be able to accelerate the program. At the end of the day, what this does not mean is that a bunch of people are going to be let out. That's not what this law does. This law does not let a bunch of people out. The Parole Board's first priority is always going to be public safety. They're always going to put public safety first. So anybody who gets paroled will have to complete their programming and make sure they're doing all the right things to be able to not be a public health risk. But if the Parole Board makes that determination that they're a risk, and it'll be determined on a case-by-case basis, that person will not be let out. If the Parole Board makes the determination that they're no risk or low risk to be able to be released, then they'll make the determination to release that person. But again, the Parole Board will make that decision on a case-by-case basis. This law does not require a lot of people to just be released. That would not be in the public interest. That would not protect public safety. The Parole Board is going to take the right steps to make sure that anybody who's paroled will be that person they determine can be paroled and not put the public safety at risk. Will you make funding priorities of building a new, will you make funding the building of a new prison a priority? In my administration, we have gone to the legislature to ask for in excess of $170 million to expand our capacity in our corrections, and the legislature has been willing to help us out by funding that so that we can expand the capacity. We've added on 260 community corrections beds, for example, and we will continue to look for ways to expand capacity. It's one of the reasons why Director Frakes has put out a RFI to get information on expanding capacity. So we're going to continue to look for ways to be able to do that, and then that will be a funding in our budget as we have steps that continue to work to push forward our strategic plan for how we're managing our corrections department. The State Parole Board is now required by law to accelerate the parole review process, yet there is no timeline or clear goals for paroling the 800 currently eligible inmates. As governor, how long will you accept Nebraska being in this emergency? Again, my understanding is that we'll be in the emergency as long as we're above the 140% of design capacity, but as I mentioned, the Parole Board is going to do its job with protecting public safety first. Every case is considered a case-by-case basis, so there is no timeline. And again, part of this will be on the inmate. If the inmate's ready to be released, and then they will get the parole, but it's really a case-by-case basis that it'll be considered. Justin, do we have any other questions that were sent in?
This is from Bill Kelly with NET News. So Governor, are you disappointed with this goal of being at design capacity not having been met?
So Bill Kelly, NET, asks, am I disappointed that we haven't met the design capacity goals that were laid out in the law? And, we had a plan to be able to work toward that. We were optimistic about getting to that goal. And then, as you're probably, anybody who's been following the issue knows that we've seen an increase in the number of felony convictions, the number of felons coming into the system. So we were not, part of the program, not able to do it. But, again, we're continuing to make the investments in our correction system, whether it's additional facilities, whether it's in our people, protective equipment, and so forth, to be able to protect the public safety, and that's what we're going to continue to do.
And there's a second question from Bill with NT News. Has there been any discussion or analysis about the feasibility of sentencing reform and alternatives to prison for nonviolent offenders and how that can play a role with the capacity?
So the question was from Bill Kelly about additional sentencing reform. Folks, we passed LB 605 back in 2015, so we've really done the sentencing reform. There really isn't any need to do anything more. I'm going to want to continue to protect the public safety. The expectations for LB 605 were not met with regard to what it would do with regard to our inmate system, so we're going to need to look at other solutions. Sentencing reform, we've done it. It achieved what it was going to achieve. Now we need to look at other solutions.
And you may have touched on a little bit of this already. Brandon with NTV News has a question about the temporary worker visas. How will the suspension of H1B visas affect companies and businesses in Nebraska?
Brandon with NTV is asking about how will the suspension of H1B visas affect companies here in Nebraska. I would expect that those H1B visas will not impact us as much as some states like California that have more technology workers coming into it, but I don't have any data specifically from the business community with regard to how that will impact us.
And then a follow-up on that, H2A visa workers aren't affected. Again, this is coming in from Brandon from NTV News. H2A visa workers aren't affected. How does that benefit Nebraska and ag?
Brandon also follows up, H2A workers are not impacted by the president's order. How will that impact agriculture? Again, H2A are what a lot of agricultural producers use, visas use to be able to get extra help to be able to do it. So again, that's, again, our agricultural workers are important to be able to make sure we can continue to promote our largest industry here in the state. Obviously, we're always going to be looking to make sure there's Nebraskans can take those jobs first, but if the person's not, if there's not a Nebraskan who can take that job, then the H2A worker is someone who can help us out to be able to continue to grow agriculture.
And then lastly, you may have already touched on this as well in your response to Terry's question. This is from Andrew Ozaki, KETV. Does the governor have a reaction to Director Frakes calling for the state to build another prison as an option to address the capacity issue?
So Andrew Ozaki, KETV, asked, do I have a reaction to Director Frakes' comment about additional prison capacity? And again, this is one of the reasons why Director Frakes issued an RFI to get more information. We are always looking at ways that we can continue to make sure we're protecting the public safety. Expanding capacity is one of the things that we've done in my administration. We'll continue to do so, and we'll look at the information Director Frakes gets with regard to the additional capacity he's seeking to build. All right, that's all the questions we have that were sent in to us. Questions from the room? Paul.
When you talk about tests in Nebraska, you didn't mention CHI Health. Are they done?
Oh,
Doing the testing? Doing the lab work?
So the question was about CHI Health. I didn't mention them. The testing I talked about last week is really kind of the new relationships we have. We have the existing relationship with CHI, which continues to be enforced. So CHI is continuing to, for example, run our facility, our testing site in Omaha. So yes, we're continuing to work with them. These are the new relationships.
So are they still doing the lab?
So CHI is still doing lab work, yes, and we still have St. Eve's, which is doing the Test Nebraska lab. Yeah.
And in corrections, your director said that Nebraska's been underbilled in prisons for 40 years. So if so, why is it taking so long before you're finally at least considering a major league-sized prison?
So the question was, Director Frakes, and I did not catch the press conference, but according to Paul, said that we've been underbuilt in prison capacity here for 40 years. And so Paul's asking, why are you just now looking at building a prison? What I said is, we're looking at expanding capacity. We've been expanding capacity since I've been governor. We've done a variety of things. As I mentioned, 260 community corrections beds. We have another 100 beds that are coming online at NSP this fall. So our diagnostic and evaluation center. So we've taken a number of steps to expand capacity here. And of course, as I mentioned as well, we also had in 2015 our past 605, which we had been told would actually do more with regard to our capacity than it turned out to be. But again, so we've got a lot of moving variables here, and Director Frakes is continuing to look for ways that we can expand capacity, and that's why he put out the RFI.
Were you hopeful that LB 605 would fend off the need for a 1,000-bed prison?
So the question is, were we hopeful that LB 605 would help us with regard to our capacity? Yeah, absolutely. When we were implementing that program, we expected that there would be a greater impact from LB 605. We didn't see the impact that we thought we would see when the folks were telling us this is what would happen. But, we work with what we got and continue to build capacity.
The people who helped build that says, well, the legislature didn't pass all the sentencing reforms we asked for, and that's why it failed. So why not go back and do those and see if it really works?
Well, I actually, so Paul says the people who's saying that if we didn't pass all the reforms, who's saying that?
State governments.
Council of State Governments? Okay.
Back and ask them, well, why didn't this
Okay.
work? Well, the legislature didn't adopt it.
Okay. So Paul's saying the Council of State Governments was saying that the legislature didn't pass all the sentencing reform that they were talking about. They never said that to me. So I don't have any recollection of them coming to me and saying, you got to do more. But I will say that, again, we're not going to put Nebraskans at risk. We're not going to let dangerous criminals out. The sentencing reform we did was common sense kind of stuff. I don't know what else that they were looking for, if indeed they were looking for more. But we implemented the common sense kind of sentencing reform there. We got some benefit from it, not as much as that we thought we were going to get. Now we've got to look for other solutions. Yeah.
Can you give us an update on contact tracing, number of people trained and kind of where they are right now?
Sure. So with regard to contact tracing, our goal is to have at the state 1,000 contact tracers, and so we're working to be able to achieve that. We've got about 275 folks at the state that are trained right now with regard to contact tracing. The public health folks have about 190 people that are trained in contact tracing. I know that PRC has about 200 people that are trained, and we've got some other private companies that take us up to, if you put all of it together, are about 720 contact tracers right now. And we're continuing to negotiate with different companies to be able to take that figure up even higher so that we can do more contact tracing. Right now, I think we've got about, of our current folks in DHHS, the 275 that are trained, 50 are actually still working contact tracing. The rest have gone back to their regular jobs, and that's just because of the demand. I mean, if you look at our case counts, you can see that our case counts have really stabilized at that 100 to 130 kind of area. And so there just isn't as much demand for the contact tracers. But having said that, we want to make sure that we've got that capacity to be able to quickly ramp that up. And so that's why we want to get up to that 1,000 figure I talked about, just the state level, to be able to augment what the folks at the public health departments are doing.
So are all of those working right now?
So I think we've got about 500 contact tracers that are actually working right now. There's about 250 that, or 225 that we've got that are DHHS teammates that have other roles like in Children and Family Services that are trained but are back to doing their regular roles. Yeah.
Do you anticipate those daily case numbers will go back up the way that we've seen in other places in the country that have reopened or relaxed some of their guidelines?
So the question is, do we expect that case counts may go up? I mean, certainly with the protesters, that's one of the, I think, the common themes that we've seen is that with the protests that we had at the beginning of June, you had a bunch of people, large crowds. That's what causes the virus to spread. You also mentioned loosening restrictions. As people are out more, that's also going to present the opportunity. So we have to keep a careful watch on what's going on with regard to that. But again, I go back to what the guiding principle here, or the North Star is. It's about hospital capacity. So it's, again, about making sure we ensure our hospital capacity. And with 80% of our ventilators available right now, we've got lots of hospital capacity. So trust me, we're monitoring these numbers on a daily basis with regard to the number of cases. If you look across the state right now over the course of the last couple of weeks, the only counties that are averaging more than a couple a day are Sarpy, Douglas, and Lancaster counties, our major population centers. Every other county is really in 0 to 2 on average. over the last couple of days. Maybe Dodge County's at 4, take it back. Dodge probably is at 4, but there's all single digits. So we really have got a stable situation right now, and we're going to continue to monitor that over the course of the next several weeks to see what happens, to see if the same pattern that happens in other states happens here. And if it does, we'll use our testing and contact tracing to do the standard blocking and tackling of epidemiology, which is you test to find the person who's infected, get them to isolate so they don't infect anybody else. You go back and do 2 weeks worth of work on that person to find out who they've been in contact with. You get all those people to either quarantine or monitor their symptoms. And that's how you really manage the disease, because that's what we have to do until there's a vaccine or effective treatment. We've got to make sure that an effective antiviral, we've got to just continue to manage the virus. And so while we're in a good position right now, we can't get cocky. We've got to continue to manage this. It's something we're going to continue to do, and that's our primary line of defense is going to be that testing and contact tracing.
How were those hospital sites that are going to be doing the Test Nebraska testing chosen?
So how were the hospitals that we chose to do the Test Nebraska chosen? We actually went out to the healthcare community to look for places. We wanted to start bridging, having places around the state, again, in population centers, geographically dispersed, to really be able to do that testing so that, again, if somebody is testing positive or has the virus, we can make sure that we're testing them as quickly as possible to get them to isolate. Yeah.
So, the latest update or the latest estimate I've heard on Test Nebraska is that there have been about 1,200 tests per day on average, which is obviously quite a bit lower than the 3,000 capacity that we currently have. So what are the problems you see with that? I know we've talked about people not signing up in the more rural areas or people signing up and then kind of not showing up for that slot. But what are some of those challenges, and how do we know we're reaching the people who need to be reached with testing?
Yeah, so the question was, hey, I think we're actually up to about 1,600 tests per day through Test Nebraska. Is that right, Dr. Antone?
About 14 to 1,600.
14 to 1,600, okay. But that's not 3,000 tests per day that we've got the capacity to do. So what are the barriers to being able to reach that 3,000 or getting more tests done? And it really is, at this point, getting people signed up to do the testing. So when we're in Omaha and Lincoln, if we got our testing centers running in just Omaha and Lincoln, we can schedule 3,000 people a day. But part of the challenge is just getting people to sign up. And so you may have noticed that as I mentioned earlier, we've relaxed the restrictions on who can get tested. So really, if you sign up for testnebraska.com, you can start looking for a place to get scheduled. So we're not restricting who gets tested right now. So that's part of what we hope to do to be able to help expand that testing. And we're going to be looking at other steps that we were talking about with the team as far as how we can promote getting more testing done. Again, we want people to come in and get tested because this is one of the ways that we're going to be able to catch people who are testing positive, especially if you are asymptomatic, to be able to get you to isolate so you don't infect anybody else.
So how trustworthy are our numbers through Test Nebraska if we're really only testing people who are sort of self-selecting for testing? And there was a viewer in Omaha who told me he's gotten 3 tests in the last 3 weeks because he keeps getting emails from Test Nebraska offering him a test. But I don't know that his 3 tests necessarily tell us much about community spread, considering he's taking precautions and things like that. I don't know if that question makes sense, but basically, you're kind of self-selecting with that group.
Sure. So the question was, if you're thinking about how do you spot the virus, and the folks who sign up for Test Nebraska are self-selecting, how effective is that versus, say, a random sample? Well, we can't force people to take the test, so we really can't do true random sampling. We are relying on people to select Test Nebraska and get signed up. And frankly, you're randomly just as likely to get it one week as another week, so that if somebody is signing up multiple times or taking multiple tests, that's not a problem. Again, we want to make sure that we're getting people in and tested if they feel like they've been exposed. That's a good thing for that person to do, to be able to come in and get tested. So again, we don't have a way to force people to get tested. That's why we're promoting testnebraska.com and looking at other ways that we can promote that. Every one of these press conferences I talk about, sign up for testnebraska.com so that you can get tested and we don't have any restrictions on it. Yeah, John.
With this $85 million in community cares money, it looks like it would be going to a lot of different places. What is a broad overall goal that you're hoping to accomplish with that $85 million?
So with regard to the $85 million in community cares, our overall goal is to help those organizations that are helping take care of Nebraskans, whether it's food insecurity, housing, behavioral health. We know that a lot of organizations are challenged in raising money or providing services that they would get reimbursed for, just like folks in the private sector. And so we want to make sure that with our stabilization grant, that we're reaching those folks so that they have extra money to be able to cover maybe what they're not been able to raise in donations. And then with traditional grants, really looking at what types of programs are you putting in place to be able to help people through this pandemic, especially targeting underserved communities or communities of color, to really focus on people who may have not gotten the services that we would like to see them get through this pandemic. So it's really targeted at those nonprofits who are really helping those folks who are going to be most in need.
Governor, we have time for one last question.
Great. Paul?
When you talk about the CARES Act, I know the recommendation from the feds was use about $450 million for local communities, local governments. You took another path, and it looks like most of the money went to business and ag. Can you explain the rationale for giving less to local governments and more to business and ag?
Yeah, so the question was, when it comes to the CARES Act money, we weighted the business community and the agriculture community more heavily than local government. And the question is, why did we make that decision? First of all, actually, what we're going to do for local government is cover the cost, their coronavirus direct related costs. So cities and counties, Douglas County's got its own money, so they're kind of in a different pool. They're going to take care of themselves. But outside of that Douglas County area, we're going to be reimbursing folks directly for their coronavirus related expenses. So those local forms of government will be taken care of. And I read your article today, Paul, with regard to Grand Island. Right. So if you take what they said about $175,000, let's just rough it out, $1 million this year, maybe their expenses. That's Grand Island. We don't have 100 Grand Islands. We got one. They're like our third biggest city. So we think there's going to be plenty of money there to be able to reimburse local entities for their coronavirus-related expenses. And with regard to the business and agriculture, well, that's what drives our economy. Those are the folks who actually pay taxes that then go to government. So if you want to look at who you need to take care of first, you have to take care of the people who are actually paying the bills, and that's the business community. Agriculture is our #1 industry. Those are the folks you have to take care of and make sure they're still around to be able to generate the tax dollars that then make sure that city, county, state government can all continue to provide services.
Do you have any numbers on how many people are applying for those ag and business grants so far?
The question was, do we have numbers with regard to how many people have applied for the ag and business grants? I don't have those off the top of my head, but we can get back to you. I believe the agriculture one is has been fully subscribed. I believe there's still room left on the business grants, so if you're one of those small businesses would like to apply, somebody help me out. What's the date? Justin, do you know the date that people can apply? All right, there's still time left to apply for a small business. I don't know how. I think there's still room left on that grant, though. Well, again, folks, thank you very much for joining us here this afternoon. We very much appreciate every Nebraskan who has sacrificed to slow the spread of coronavirus here in our state. It has absolutely worked. Our hospitalizations are at the lowest point they've been since we've been tracking this in late April. We need to continue to practice social distancing to slow the spread here in our state, so please continue to keep that 6-foot distance, wear a mask when you go to the store, wash your hands, avoid large groups. All those sort of things will help us slow the spread of coronavirus here in our state. We will be back here again at 2 p.m. Central Time on Thursday, and also we will have our 3 p.m. Spanish language briefing here just in a few minutes. So thank you all very much, and we'll catch you next time. Thank you, Francis.